All right, well, all this month is Cervical Cancer Awareness Month, and there are effective ways to help prevent and screen for cervical cancer.
Well, joining us this morning is Dr. Sharon Bush-Coaxum and Dr. Donna Bennett, the first Black women OBGYN owners here in Mobile. The facility is called FBL Physicians. Thank you all so much for being here this morning.
Thank you for having us back.
Absolutely. Yeah. Let's talk about cervical cancer, what that is, and how it differs from maybe other forms of cancer.
So cervical cancer is one of those cancers that really is preventable if caught early and with the proper screening and prevention techniques. The difference between cervical cancer and some of the other cancers is that it is sexually transmitted by the HPV virus. So with prevention techniques or safe sex practices and HPV vaccination, we can help prevent cervical cancer, or at least keep it where it's a preventable or more treatable stage.
Well, this is one of the few cancers that there is a vaccine to help prevent it.
Yes, sir.
Right.
And the target age for that is get it in early. That's the target. So it targets boys and girls, the average age between 11 and 12, but as early as 9 and up to 45 years of age in some cases.
Wow. Well, let's talk about some of those early signs. What should women or just people in general be looking out for?
Right. Unfortunately, cervical cancer is mostly asymptomatic. There are no symptoms. But when we do see a woman who has abnormal vaginal bleeding, that kind of makes us absolutely want to at least do screening or see where they are in that process, because other than that, and some back pain and maybe a little bit of pelvic pain, there are not a lot of symptoms about cervical cancer.
Wow.
Is there a regular screening for this?
Absolutely. We recommend that the patients get screened every 3 years with cytology alone in their early from 21 to, let's say, 29. And then after 25, you can add the HPV testing to kind of really hone in what is actually going on. As Dr. Bush-Coaxum said, the cancers have been found to be mostly HPV related, which accounts for 90% of those cervical cancers.
I want to harken back to the vaccine, though, and you mentioned it's such an early age. 9 to 12 is the ideal age for that vaccine to be given, and that includes not only young girls, but boys, too.
Absolutely.
Yes, sir. And the other thing, even though we're talking about cervical cancer, there's over 100 different types of HPV viruses, and they are linked to other different cancers, so which is why we target both boys and girls.
Gotcha. Okay. Well, we have a QR code on your screen where you can scan it with your phone. We'll give you a few seconds to do that and learn more information, and to also follow FBL Physicians page on social media. We certainly thank both of you all for being here today.
Thank you for having us.
Thank you for having us.
We're coming back with more in just a moment. Keep it right here.